Good afternoon. I'm Michelle Pinkston, and I'm the Director of Pharmacy Emergency Preparedness for the Kentucky Pharmacists Association. I'm so happy you've joined us this afternoon to learn about some exciting changes from the Kentucky Department for Public Health with the yellow fever vaccine application. Recently, pharmacists were added to the application so that pharmacists can now apply to become yellow fever vaccine stamp holders. And this is an exciting change because prior to the change, it was physicians and nurse practitioners that were able to apply for the stamp. So I'm delighted today that we have members of the team at Kentucky Department for Public Health with us, especially Carrie Tuggle, and she is with the Kentucky Department for Public Health Immunization Branch. And she wears several hats there. She is the influenza surveillance coordinator, as well as the administrator for the Kentucky Yellow Fever Vaccine Program. So she's going to bring some of the new information to get us started. And then I'm going to jump back on at the end and talk a little bit more about the regulatory side to implement the new vaccine. So with that, I'll turn it over to Carrie. Carrie, take it away.
Thanks, Michelle. Good afternoon, everyone. As Michelle said, I'm Carrie Tuggle. I'm the Yellow Fever Administrator for Kentucky, and I'm here today to provide a brief yellow fever certification update regarding pharmacists. Next slide. Previously, the Kentucky Department for Public Health's policy to become an authorized yellow fever provider was limited to licensed physicians and nurse practitioners. However, KDPH has now expanded that certification to include licensed pharmacists, and we've updated the guidelines for those providers collaborating with a certified stamp holder to administer yellow fever vaccine. Each authorized stamp holder who employs or collaborates with physicians, nurses, or pharmacists to administer yellow fever vaccine shall not permit a provider to administer the vaccine until they've completed KDPH's required CDC yellow fever vaccine course and any training required by relevant administrative regulations or professional board. They must also maintain training records for each provider permitted to administer the vaccine by proxy, as well as provide evidence of that training upon request by the Kentucky Immunization Branch. Next slide. The Kentucky Immunization Branch webpage has been updated with a link to access the Yellow Fever Vaccination Center application online. It's located under the For Healthcare Professionals heading, highlighted here on the right. I've also provided links in this PowerPoint presentation, and I think Michelle will share this with everyone afterwards. So you can actually click on the link and it'll take you to the actual website. Next slide. Here is a quick look at the updated application to include pharmacists. Previous guidelines that remain in effect are as follows. Authorized providers are to maintain proper storage and handling of the vaccine at a temperature between 35 to 46 degrees Fahrenheit. The stamp is non-transferable and is only to be used by the provider to which it's assigned. Any adverse reactions to the vaccine or other complications should be reported on a VAERS form to the Kentucky Immunization Branch. Also, providers are to submit a signed copy of their yellow fever vaccination protocols annually and report the number of yellow fever doses administered quarterly to the Kentucky Immunization Branch. Next slide. You can access the required CDC yellow fever vaccine course through CDC's Travelers Health webpage. Under clinician resources, you will find the yellow fever vaccine course. Once selected, you can follow the guidance to enroll and take the course. Upon completion, each provider is required to submit a copy of their certificate to the Kentucky Immunization Branch, and as provider meaning stamp owner. So as I mentioned earlier in the first slide, each stamp owner is responsible for maintaining all other training records for other providers permitted to administer the vaccine. And that's all I have. I'll turn it over to Michelle so she can share the information she has.
Michelle, before we start, I want to add in one thing. If you're Dr. Jones and you work at a chain pharmacy and, you're pharmacist Jones and you work at a chain pharmacy and you are the yellow fever stamp holder, we want your training certificate. if there are 15 pharmacists that work at that chain pharmacy with you, then at that one location, those 15 pharmacists must provide to the stamp holder their certificate. So you're the manager of all the people at that one location. Each location, as Michelle will talk about, will have to have their own stamp. We don't want everybody's certificate because we recognize there's turnover, especially if you're working with a university that has a pharmacy program, and some of those pharmacy students may be yellow fever trained and administer those vaccines. But the administrator is responsible for managing and ensuring that the people that administer the vaccine at that site, all those records are up to date. And at any point in time, we could randomly audit you to make sure that those records are in place. So we added pharmacists to this, number one, because we have lots of pharmacists that are post-pandemic seeking information on becoming yellow fever stamp holders. And number two, we only had 13 yellow fever sites in Kentucky. So we had a clear access to care. So we had a desire from a group of pharmacists that wanted to offer this service, as well as we had a need for our citizens here in Kentucky. We appreciate pharmacists wanting to take this on because we need you. And so thank you very much. But we also recognize that there may be many people within one pharmacy that will be administering vaccines. So we need you to help us making sure that your records and your training is always current with those individuals. So I hope I stated that correctly, Michelle and Carrie, and then I'll turn it over to Michelle.
Thank you, Dr. Harrington. So when KDPH contacted me and told me they were thinking about making this change with the application, I reached directly out to the Board of Pharmacy because I wanted to make sure I completely understood the best way to implement, for pharmacists to implement the yellow fever vaccine into your practice. And because I knew there was a board approved travel health protocol. So I reached out, and because the board approved travel health protocol really just covers oral travel medications and oral vaccines, the yellow fever vaccine should be incorporated in your prescriber approved immunization protocol. And this is just because the yellow fever vaccine, being a vaccine and immunization, falls under the KRS statute that you see here. And you will have, where you can vaccinate 18 and above pursuant to your prescriber approved protocol. And then of course, 9 to 17 with your prescriber approved protocol with the consent of the parent or guardian. So essentially to implement this, however you have your current prescriber approved immunization protocol in place, you would just need to do an update or an edit to add the yellow fever vaccine to incorporate it into your practice. And lastly, with that travel health note, I want to let you know about an opportunity. If you do have an interest in the pharmacist travel health certificate, there's a great opportunity coming up in June. KPHA's annual meeting is going to be held June 8th through the 11th in Bowling Green. And on that Friday, June the 9th, Clark Kevido from the University of Kentucky will be teaching the live version of the certificate program. This is one of those programs where you have to do some 6 hours of home study, and then you have the in-person class, and that class will be 10 a.m. to 2:30 p.m. on the Friday. You can do it as a standalone session, or you can choose, we hope you choose to attend the whole conference. But along with the travel health certification program, Dr. Kevido will go over this new change to the yellow fever application as well. So we hope you'll join us. I have the link there. You can also, if you go to the KPHA website, you'll see this banner. You just click on the banner, and it also will take you directly to register for the conference. So with that, we don't have any other information to share, but I would love to take any questions. If there's anyone out in the audience who have any, if anyone joined us late and you need us to cover something, we're happy to do it. And Emily, I know you're monitoring the chat, so if you see any questions. can let me know.
Hey, Michelle, thanks for presenting the information today, and Carrie as well. So what if you're become PIC at a pharmacy, and maybe the stamp holder that had their, okay, what's the process for, I guess, changing who the stamp holder is at that location? If the stamp holder were to leave and go work somewhere else?
I'm going to defer to Dr. Harrington for that.
And I'm going to refer to Carrie. Carrie, if the pharmacist that's at a clinic is the primary stamp holder and he leaves and goes, let's say he goes to a different pharmacy in the state. So Ben, I'm going to change your question to twofold. If Ben Mudd is at Netherlands a pharmacy in Louisville, and he's a stamp holder, and he moves to Mayfield, Kentucky. First, does he take his stamp with him?
Yes, he can. However, he would need to notify me because I would have to update his address change and provider clinic, I guess, pharmacy change in the registry because Sanofi, that's where the vaccine gets shipped to. And so all that has to be current and up to date. But as far as the current, someone else would have to apply to be a stamp holder at the current facility.
So would it be
Does
safe
that
to
answer
say
those questions?
that the stamp is tied to the person at a specific location and not the location individually? Is that accurate,
Correct.
Carrie? Ben, does that answer your question?
That is correct. And so
Yeah, that answers it. So at that point, one of the other pharmacists would need to step up, and then that person would become responsible for ensuring that everyone had completed the program that qualified them to provide the vaccine. Okay. Yeah, thank you all.
And then when you went to your new location and took your stamp with you, if you wanted to maintain your stamp, then you would need to make sure everybody at the new location got their training up to date so you could offer that service there.
I have one question too, just for clarity's sake. So once a pharmacist does the yellow fever training, like say the CDC training that's required as part of the application, does that a one-time only, or if I am a pharmacist and I worked under Ben and I moved to another pharmacy, they had a yellow fever stamp, or the pharmacist there had one, I'd already done the training, would I need to do the training again at my new workplace, or does that transfer with me? Because I would be working under a new yellow stamp holder. Sorry to
Carrie, do you
ask.
wanna-
I just thought this might be a
how-
question.
No, so the yellow fever training does not have an expiration date. However, we know with vaccines, things get updated. So as a new version came out, you would need to update that. If you were moving and going to, Ben's clinic, and you said 10 years ago, I did the yellow fever training, here's my certificate. As the stamp holder, he may say, Michelle, thanks so much, but it's been 10 years. So let's get you updated. So that administrator could make that decision. But knowing that the training doesn't have an expiration date, like CPR, CPR is for 2 years. Knowing that it doesn't have an expiration date, it would just be required to update it as updates occurred.
So, Carrie, Patty, Amy, everyone from KDPH, along with Michelle. First, thanks so much for the plug. I hope pharmacists that are watching this either here today or, on recording, that you consider embracing travel health in your practices and really leveraging our access points at community pharmacy. So on behalf of KPHA and pharmacists, thank you all for your efforts and helping with this. I put the CDC CE link in the chat. The only other thing I was going to ask, if the pharmacist completes the requirements that you all have shared in the slides today. Is this link from the CDC website where those show up? So the next link I put in there was the CDC's yellow fever vaccination clinics. You can sort by state. And basically, if they follow these steps, will their pharmacy practice show up here for patients to access?
Yes, they will. I maintain that registry, and so as each pharmacist is added, I update that and it should be live.
Excellent. Well, straight to the source. We appreciate it, and just wanted to check.
And looking at that training, Clark, I appreciate you providing that link. If you look, there isn't there is a word that says recertified to September 7th, 2023. So my perception is they anticipate an update coming in 2023 on that yellow fever vaccine course. Do you see that?
Yep. So it's accredited for pharmacists, physicians. It's a good training. I think even if you've done it for the first time and are doing it, they update it every couple of years. There's been a change for a little while on how patients access the yellow fever vaccine, for example. So even if you've done it, I think they're required by the various continuing education bodies to keep it up to date. So they have the the various expirations. It might apply to nursing or might apply to one of the other professions as well. But yeah, they do a good job keeping that up. But yeah, it looked like it was good until September of 23, which they'll probably issue another edition at that point.
And so I think that at that point, evaluate it to see if with continuing education requirements, there's this, what's it called? I'm going to use the word longevity. The developer has the responsibility to re-review the content and then add an additional year span, knowing that this is good until 2023 for CE. I would reevaluate and look at that to see if there's changes in the content. Michelle, to answer your question, for changes as we see annually, ACIP recommendations get updated, et cetera.
Thank you, Dr. Harrington, and thank you, Dr. Thibodeau. Appreciate you jumping in. I couldn't see you on my list, or I was going to call on you when I was talking about the certificate. So thank you for jumping in. Or if anyone has any other questions, we're happy to take them now. And I don't see any new questions in the chat. So with that, feel free to reach out to me personally if you have any questions. I can get you contact information for Carrie and for Dr. Harrington if you need to speak with them directly. But we thank you for attending today, and I hope we see you in Bowling Green on June the 9th, taking Dr. Thibodeau's travel health certificate. Thank you all so much.
And thank you